The objectives of this presentation are to learn about different types of cardiovascular diseases, to understand cardiovascular disease statistics, to learn about the pathology of cardiovascular disease, to understand risk factors for cardiovascular disease, and finally, to understand the impact obesity has on the risk for cardiovascular disease. So what is cardiovascular disease? Cardiovascular disease, or CVD, refers to any health problem that affects the heart or blood vessels. A simpler term that's commonly used to describe cardiovascular diseases is heart disease. The major form of heart disease involves a process called atherosclerosis. Atherosclerosis involves the blockage and hardening of arteries due to plaque buildup. Other forms of heart disease include things like heart failure and heart valve problems. The association of obesity and heart disease primarily involves heart diseases involving atherosclerosis. Atherosclerosis causes arteries to narrow, weaken, and be less flexible. It's the term for the process of fatty buildup in the inner lining of the arteries. The buildup that results is called a plaque, and it reduces the amount of blood and oxygen, including nutrients, that's delivered to vital organs throughout the body. When blood flow is blocked in coronary arteries that supply the heart muscles with blood, this results in a heart attack and is referred to as coronary artery disease. When blood flow is blocked in a carotid artery that supplies the brain with blood, this results in a stroke and is called carotid artery disease. When blood flow is blocked to arteries outside the heart and brain, it can result in loss of limb and is called peripheral artery disease. These are all different forms of cardiovascular disease that involve the process of atherosclerosis. Heart disease is a leading cause of death for both men and women in the United States. It affects people of all ages. You can see on the chart here, on the left y-axis is the number of deaths per year, and on the y-axis it breaks the groups down by all ages, people less than 85 years of age, and people greater than 85 years of age. Within each age grouping, there are 3 bars. The first bar on the left includes all cardiovascular disease. The second bar, the black bar, is cancer deaths, and the third bar is deaths due to chronic lower respiratory disease. You can see clearly from this graph that cardiovascular disease is the leading cause of death for people of all ages. About 600,000 people die from heart disease or coronary heart disease each year. That's 1 in 4 deaths. Coronary heart disease is the most common type of heart disease. In the United States, someone dies of a heart attack every 34 seconds. Each minute, someone dies from a heart disease-related event. Heart disease is also the leading cause of death for people from most ethnic racial groups. In the United States, this includes African Americans, Hispanics, and whites. For Asian Americans or Pacific Islanders and American Indians or Alaska Natives, heart disease is second only to cancer. Coronary heart disease alone costs the United States $109 billion each year. This includes the cost of healthcare services, medications, and lost productivity. This slide highlights heart disease death rates in adults throughout the United States. The darker the red color, the greater the death rate due to heart disease in a county within the United States. You may have seen slides like this before that highlight obesity rates. They match up quite well with obesity as a risk factor for heart disease. This simple model of atherosclerosis introduces you to the major players involved in the pathology of this disease. 2 major players are blood lipids and inflammation. First, damage to the artery wall causes inflammation and recruitment of macrophages to the damaged location. The macrophages take up blood lipids in the form of low-density lipoproteins and produce inflammatory cytokines. As the lipid accumulates within the macrophage, they become foam cells. Lipids can also be removed from an atherosclerotic lesion through a process called reverse cholesterol transport. And this process is mediated by a specific type of lipoprotein called a high-density lipoprotein. The major lipid player in atherosclerosis is cholesterol. Cholesterol is a soft, fat-like substance found in the bloodstream. It's also found in cells throughout your body. In fact, every cell in your body can make its own cholesterol. It's not an essential nutrient. Because cholesterol is not soluble in water, it's also not soluble in the aqueous environment of your blood. It needs to be transported using a very special vehicle called a lipoprotein particle. Low-density lipoproteins, or bad lipoproteins, deliver cholesterol to cells throughout your body, as well as to the macrophages present in atherosclerotic lesions. As cholesterol accumulates in the atherosclerotic lesions, the arteries can become clogged and narrow and prevent blood flow carrying nutrients and oxygen throughout the body. The high-density lipoproteins, or the good cholesterol, can pick up cholesterol from peripheral tissues as well as from the macrophages in atherosclerotic lesions and return that cholesterol back to the liver for excretion from the body and reduce atherosclerotic lesion size. This is why high-density lipoproteins are considered good cholesterol. So here's a little more detail about the pathology of atherosclerosis. This disease process begins with damage to the artery wall. It's not exactly clear what causes damage to the artery wall, but some potential players include hyperlipidemia, or high levels of lipids in the blood, high blood pressure, and cigarette smoke. In an effort to repair the damage to the artery wall, your body develops an immune response and recruits macrophages to the site of damage. These macrophages engulf cholesterol that's being carried in low-density lipoproteins in your blood, and a fatty streak starts to develop. As macrophages accumulate more lipid in the form of cholesterol, a fatty layer, or an atheroma, develops. As this process progresses and more macrophages become foam cells carrying cholesterol, a plaque forms. As the plaque grows, it decreases the blood vessel diameter, reducing the ability of blood to flow through the blood vessel. Eventually, these plaques can become unstable and break off from the artery wall and be transported throughout the body to smaller arteries where they can completely block blood flow to the heart, peripheral tissues, or the brain. A myocardial infarction, or a heart attack, occurs when the heart muscle tissue does not receive the vital oxygen and nutrients because of this atherosclerotic process. Now that you know a little bit about the pathology of atherosclerosis, some of the risk factors for atherosclerosis may make a little more sense. Some risk factors are not modifiable. Things like family history, increasing age, and gender are things we can't do much about. However, many risk factors for atherosclerosis are modifiable by lifestyle modifications and/or drugs. These risk factors include high blood total cholesterol levels, including high low-density lipoproteins. Remember, these are the lipoproteins carrying cholesterol to the atherosclerotic lesion. Having low levels of high-density lipoproteins, or the good cholesterol. Remember, these are the lipoproteins that are picking up cholesterol and taking it away from the atherosclerotic lesion. High blood pressure, cigarette smoking, physical inactivity, being overweight or having obesity, and diabetes are all modifiable risk factors for atherosclerosis. Obesity is now considered a disease. Often, obese patients also have a syndrome called metabolic syndrome. Metabolic syndrome is diagnosed when a person has 3 or more of the following characteristics. These include abdominal obesity, high levels of lipids in their blood, high triglycerides, low levels of the high-density lipoproteins, high blood pressure, high fasting glucose, insulin resistance, or glucose intolerance. You can see that many of these characteristics are also risk factors for cardiovascular disease. Obesity, overweight, physical activity, and genetic factors all contribute to metabolic syndrome. Therefore, it's not surprising that people with metabolic syndrome and obesity also have an increased risk for cardiovascular disease. In fact, their risk for cardiovascular disease is 2 times greater than a person without these problems. The resources that were used to put this presentation together include information from the Center for Disease Control, the American Heart Association, and the National Heart, Lung, and Blood Institute.